Good day, my name is Miko Wong, and today I'm going to present my SSM. The topic I've chosen is the urinary system and the kidney, with a focus on the structure, function, diseases, and modern technology related to the kidney. So first of all, let's take a look at the urinary system. The urinary system consists of four main organs, which are kidneys, ureters, urinary bladder, and urethra. So among these organs, the kidneys plays the most crucial role. They are responsible not only for removing metabolic waste products from the blood, such as urea and creatinine, but also for regulating body fluid, electrolytes, acid-base balance, and blood pressure. Now let's take a look at the gross anatomy of the kidney. The kidney are paired bean-shaped organs located in the posterior abdominal wall and are classified as retroperitoneal organs. They lie approximately between the T12 and L3 vertebral levels, with the right kidney position slightly lower due to the presence of the liver. Externally, each kidney is surrounded by a fibrous renal capsule, followed by layers of adipose tissue and renal fascia, which provide protection and support. Internally, the kidney is divided into two major regions, which are the outer cortex and the inner medulla. The medulla is organized into cone-shaped structures called renal pyramids, which play a role in urine concentration. The urine formed within the kidney flows from the pyramids into the renal pelvis and then passes into the ureter, which transports it into the urinary bladder. This structural organization allows the kidney to efficiently filter blood and form the urine. Next, let's take a look at the nephron. The nephron is the basic structural and functional unit of the kidney. Each kidney contains approximately 1 to 4 million nephrons, which work together to perform filtration and urine formation. Each nephron begins with the renal corpuscle, which consists of the glomerulus and Bowman's capsule. The glomerulus is a network of capillaries where filtration occurs, while Bowman's capsule collects the filtrate. After filtration, the filtrate passes through the proximal convoluted tubule, loop of Henle, distal convoluted tubule, and finally into the collecting duct. Each segment is lined by specialized epithelial cells that are adapted for specific functions, such as reabsorption or secretion. The close relationship between structure and function in the nephron allows the kidney to efficiently regulate fluid balance, electrolytes, and waste removal. Next, let's talk about urine formation. So urine formation occurs through three main physiological processes, which are glomerular filtration, tubular reabsorption, and tuberous secretion. First, during glomerular filtration, high hydrostatic pressure forces the water and small solids out of the blood and into Bowman's capsule, forming the glomerular filtrate. This filtrate is typically free of blood cells and large proteins. Next, tubular reabsorption occurs mainly in the proximal convoluted tubule and loop of Henle, which approximately 99% of filtered water and useful substances such as glucose, amino acids, and ions are returned to the bloodstream. Finally, the tubular secretion. Tubular secretion removes additional substances, including hydrogen ions, potassium ions, and drugs from the blood into the tubular fluid. Together, these processes ensure that waste is eliminated while essential substances are conserved. So the next part that I'm going to discuss is kidney diseases. There are two diseases that will be covered in this study, which are kidney stones and chronic kidney disease, CKD. So first of all, the kidney stones form when minerals such as calcium crystallize in the concentrated urine. Small stones may pass without symptoms, but larger stones can cause severe flank pain, blood in the urine, and urinary obstruction. The treatment depends on the stone size and may include hydration, medications, lithotripsy, or surgery. And then the next one is the chronic kidney disease, CKD. On the other hand, it's a progressive and irreversible condition characterized by gradual loss of nephron function. The most common causes are diabetes mellitus and hypertension. CKD often remain asymptomatic until advanced stages, so making early screening and prevention is extremely important. CKD is clinically staged based on GFR, which is the glomerular filtration rate value. And when GFR falls below 15 ml per minute, the condition progresses to end-stage renal disease, which requiring renal replacement therapy. Last but not least, I'm going to present about the technology related to the kidney. So first of all, dialysis is a life-sustaining therapy used in advanced kidney failure. It partially replaces kidney function by removing metabolic waste, excess electrolytes, and water from the blood. Although it does not fully restore normal renal function, but dialysis helps patients survive when the kidney can no longer maintain homeostasis. And there are two types of dialysis, which are peritoneal dialysis and hemodialysis. So the next one is kidney transplantation. It is the most effective long-term treatment for end-stage renal disease. A healthy donor kidney can restore near normal renal function. And then the last one is mass spectrometry. It represents a normal diagnostic advancement in nephrology. It allows highly sensitive detection of proteins and metabolites in urine and blood. It enables early identification of kidney injury and disease progression, often before conventional markers such as serum creatinine or GFR. So in conclusion, kidney health is essential for maintaining overall body homeostasis, and advances in medical technology have greatly improved outcomes for patients with renal disease. Overall, early detection, appropriate treatment, and the application of modern technology are key to improve survival and quality of life in patients with kidney disease. Thank you for listening.